Hello, everybody. I get questions all the time about what should I do next for my knee pain? What should I do next? And so, and it's mainly knee pain, of course, could be hip pain, back pain, ankle pain, orthopedic injuries. So I often get asked, and really it's a complicated question to answer. My first thought always goes to, well, was there an injury? Should you go get an x-ray? If you have knee pain that's been ongoing for a while, you're probably like some of my clients, like my client Jillian. She had a meniscus tear a few years ago, and that happened before she started working with me. And she was running, she stepped wrong, she twisted her knee. It wasn't much, just a little bit of a twist. It sidelined her for a week or so. And then she was back at it. Over the next few months, her knee would act up, the pain would come and go. And so she saw her doctor, who referred her to an orthopedist. The orthopedist said she could do surgery, a meniscectomy specifically to clean it up, or just do a cortisone injection. She chose the cortisone injection and it worked like magic. The pain was gone. And so then her doctor said, well, you could try physical therapy. It might help. And she decided to not do the physical therapy, but she wanted to make sure that her pain didn't come back. Her mom wanted her to go to physical therapy because it helped with her knee arthritis. Her sister said to just get a personal trainer. Her dad said, go get a massage. So what should she do? Who should she see? So what I'm going to talk about today is the different options and what I tell my clients to do. Now, of course, this is not meant to be personal medical advice. This is the process I think of when I'm helping somebody decide. You need to take the best choice for yourself. And if you really have no idea and your knee really, really hurts, just go see somebody. Okay. So like I said, this video is not meant for personal medical advice. So, okay. So now that I've gotten that out of the way, how do we decide what the next step is? So we're going to talk about physical therapy. We're going to talk about massage. We're going to talk about personal training. We're going to talk about going to see a registered dietitian or nutritionist, and going to talk about talking to a surgeon to have surgery. Okay, so let's talk about physical therapy first. So for those of you who don't know me, I'm Dr. Ali Marty. I have a Doctor of Physical Therapy degree. I graduated from Ithaca College in 2012 and then started my own business in 2018 and continued on and actually got personal training and nutrition coaching certifications. So I've been in the traditional physical therapy clinic. So if you're wondering if you should go to physical therapy, ask yourself a couple of questions. Did you have recent surgery? Did you have a recent injury that has been checked out, but otherwise you're still in pain, but technically good to go? Do you have longstanding pain, yet you don't know which exercises will do harm, which ones will help? So someone should go to physical therapy if they've had recent surgery. There are guidelines after surgery when you can use your body part, when you can put weight through your leg, start using weights for exercise, and other things. So the physical therapist will be able to instruct you how to use your assistive device if you have one after surgery, put on an arm sling or a brace, a knee brace, how to use the bathroom, how to get in and out of a car, and do other activities of daily living. They'll also be able to instruct you in the proper exercises to do that will support healing and not do more harm. So if you had a recent injury, you should also go to physical therapy, with the caveat that you didn't break a bone. You tore a tendon, a ligament, a muscle, or have tendonitis, you should go to physical therapy. So let me just back up a second. So caveat with that is this: if this is a new injury, go see a doctor, go see a physician. If it's a long-standing injury and you've tried physical therapy before, like, just keep listening. Physical therapy is excellent to help rehab injuries, recent surgeries, or recent accidents. You need to make sure you know relatively what the problem is. Now, I will say physical therapists can tell you, oh no, this is not a physical therapy thing. Like, I think you broke your bone, go get an x-ray, go get a cast. So in most states in the US, you can go directly to a physical therapist. It's called direct access. You don't need a referral. in order to see them. Your insurance may require you to have a referral to pay for it, but legally you can go see them. We're autonomous practitioners. And so they can help determine, did you tear a tendon? Did you tear a ligament? Did you sprain something, strain something? Did you break a bone? And then if they deem it appropriate, they'll keep you in physical therapy to help rehab the injury, the recent surgery, the accident. They can teach you how to do regular activities, how to exercise without doing more harm, and actually help the body heal. You should consider going to physical therapy if you have one or more medical conditions that affect how you exercise. So if you have diabetes and your sugar levels aren't controlled, if you have high blood pressure and it's not controlled, or you have low blood pressure and it's not controlled, these, in addition to other medical conditions, would warrant seeing a physical therapist if you want to start exercising. The physical therapist can guide you in how to monitor your signs and symptoms, including sugar levels with test strips. They can monitor your blood pressure throughout the session, and they can guide you through exercises that are less likely to make your blood pressure spike or plummet. So physical therapy is great for someone who's injured or recovering from surgery, needs to learn how to do basic daily activities like toileting, getting in and out of a chair, getting dressed, using a sling, using a brace, etc., has lots of medical conditions that affect their exercise routine. And you can just get an overall all-encompassing routine. So now let's talk about massage therapy. So if you're wondering if you should go to a massage therapist, I want you to think of these questions. Do you get muscle cramps that come and go and limit you from exercise or activity? Do you get muscle spasms that leave you in bed all day long? Do you have soreness in your muscles after exercise or running? So massage therapy is great for muscle cramps, muscle spasms, and soreness in your muscles. Massages are an excellent way for helping calm down tight, cramped, and spasmed muscles. If you're getting charley horses in your calf muscles that make it hard to sleep, massage can help. If you have back spasms that come and go, and spasms that are so hard that it makes you lay in bed all day, a month of massage can help. And if you're regularly exercising or running and you're sore for more than a day or two after the exercise, massage can help. I will say that there is a caveat to this, just like everything. For the first two instances that I talked about, the charley horses, muscle cramps, and the muscle spasms, massage therapy should not be the only treatment. The muscles are cramping and spasming for a reason. And so you should also seek guidance on how to strengthen those muscles so that they can stop spasming, and maybe seek out a registered dietitian or somebody who can diagnose if you are deficient in vitamins or minerals. Okay, so those are reasons to get a massage therapist. Let's talk about a personal trainer. So if you're starting out with a personal trainer or want to start out with a personal trainer, ask yourself these questions. So, am I brand new to exercise? Never exercised before in my life. Are you recovering from or currently have an injury? Do you want to learn how to use the equipment, weights, machines, things like that? And do you like being held accountable to somebody? So if you're brand new to exercise, you're not recovering from, don't currently have an injury, then working with a personal trainer is a great step. A personal trainer knows how to guide someone through an exercise program to help them reach their fitness goals. Many people sign up for a personal trainer to lose weight, and this can be really helpful because increasing your fitness can help you lose weight. If you have an injury or are recovering from an injury, a personal trainer is not the best place to start. I do recommend going to see a physical therapist first. Then once you're done with your rehab program and still need to continue to progress with your strength and exercise, then sign up with a personal trainer. If you're looking to learn how to use the equipment in the gym, like the weights and machines, signing up for a few sessions with a personal trainer is an excellent idea. The ones at the gym you're a member of, they'll know the machines there and how they work. Take a few sessions with the personal trainer to make sure you know how to use each piece of equipment properly. This will decrease your chances of injuring yourself or breaking the equipment. If you already know how to exercise properly, but you tend to let everything else get in the way and you feel like you never make it to the gym, or never work out, then a personal trainer is a good fit for you. A personal trainer will hold you accountable to keeping up with your routine and workouts. They are there at the gym, so you have someone waiting on you to show up. I love personal trainers for clients who already know how to exercise but need help with the accountability piece. Finally, I will note that you want to make sure you're clear with the personal trainer about what your goals are and what kind of exercise and workouts you like to do. If you sign up with a personal trainer who likes and trains people in HIIT workouts, but you don't like high intensity and want something challenging but more mellow, then that personal trainer would not be for you. Make sure to talk to the personal trainer about what kind of workouts they train people in and what you want. So personal trainers are great for people who need accountability for an exercise program, need to learn how to use the machines at the gym, need guidance on when to increase weight and resistance, with the caveat being that you're clear with the personal trainer about what kind of exercise you do or don't want. HIIT, CrossFit style, just using machines, just using dumbbells, just using a mat, things like that. Okay, let's talk about getting a registered dietitian or a nutritionist. So if you're wondering if you should work with a registered dietitian or a nutritionist, ask yourself these kinds of questions. And I will say, registered dietitians and nutritionists are not all the same. Okay, a registered dietitian has an advanced degree, and in some states, anybody can call themselves a nutritionist. So be very careful about that. Okay, so have I been diagnosed with a food allergy or a sensitivity? Have I been diagnosed with a medical condition that means I need to limit certain foods? Do I need to supplement my diet with vitamins and minerals from sources other than foods? And do I need guidance on getting proper nutrients in my diet? So if you've recently been diagnosed with a food allergy, food sensitivity, or medical conditions for which you need to limit certain foods, you should seek counsel from a registered dietitian. This type of provider can give you specifics regarding the foods you should avoid and foods you should continue eating in your diet. Registered dietitians are good at telling you where those foods and their derivatives are hiding. If you need guidance on what supplements to take, whether they be in pill form, IV, powder, whatever, you also want to see a registered dietitian. The registered dietitian can tell you which supplements to take and in what medium to take them for the best results. If you need guidance on getting proper nutrients in your diets and aren't sensitive to, allergic to certain foods, or have a medical condition, then seeking guidance from a nutritionist or a nutrition coach is the way to go. So nutritionists and nutrition coaches can give you recipes and food recommendations to fulfill the needs of your diet. The nutritionist or nutrition coach should not be recommending supplements or formulating a diet for you. They should be guiding you through recipes and meal recommendations to fulfill the diet recommendations that the registered dietitian has indicated you need to follow. So the nutritionist or nutrition coach can make general recommendations, but they should not be specific to a medical diagnosis. So a registered dietitian or nutritionist is good for someone if they have a medical diagnosis and need to avoid certain foods. See a registered dietitian. Know what foods you need to avoid, but you don't know how to incorporate those in recipes. That could be a registered dietitian or a nutritionist. A registered dietitian will guide you in what foods to eat or avoid based on a medical diagnosis, and a nutritionist can guide you to the foods that have what nutrients are in them, incorporate more macros into your diet, recipes to incorporate those nutrients into your diet, okay? So now let's talk about when to have surgery. So if you're wondering if surgery is the right way for you to go, ask yourselves these questions. So did I recently have an injury and my knee gets stuck in one position that needs another person to get it unstuck? Is there a hard bump that's normally not there and it moves around? Did I have an x-ray and was told I have an unstable fracture? Do I have arthritis and my knee hurts so much that I don't even want to get up and do the normal daily activities like going to the bathroom. So those aren't the all-encompassing questions to ask, but those are our first few guiding questions. And those were very specific to the knee. So surgery can be necessary. And to determine if you need surgery, I recommend asking those questions. If you have an injury that makes it so that your knee gets stuck in a position, like it gets stuck bent, and you can't straighten it out without somebody else manipulating your leg, you should seek advice from a surgeon. You may have an injury in your knee, like a meniscus tear, that blocks the knee from moving properly. If you've had an injury recently and now you have a bump that moves around, sometimes you can see it, sometimes you can't. This could be a floating piece of bone that chipped off from somewhere. You should seek advice from an orthopedic surgeon. If you recently had an injury, got an x-ray, and were told that you have an unstable fracture, then you should seek advice from a surgeon. An unstable fracture cannot heal on its own, and it needs to be surgically repaired so that it's stable again and can heal properly. If you have arthritis, osteoarthritis specifically, if you've had it for a while and now it's to the point where you don't even want to get up to go to the bathroom because the pain is so bad, then I recommend seeking guidance from a surgeon. You may need a knee replacement. This is usually the point that I recommend patients wait until, if they're debating on if they should have a knee replacement. Wait until it's too painful and you don't even want to get up to go to the bathroom anymore. So get advice from a surgeon if you have a meniscus tear that makes your knee get stuck in one position and you can't get it unstuck. If you're seeing a hard bump moving around in your knee, if you were told you have an unstable fracture, or you have osteoarthritis that's gotten so bad you don't even want to get up to go to the bathroom. So finally, what do you do if you've gone to physical therapy and it didn't work? You don't need or want the one-on-one advice of signing up with a personal trainer at the gym, but you need something. What should you do? So this is the exact scenario that I help my clients with. I'm a licensed physical therapist right now in the state of Nevada, also previously in Massachusetts and Rhode Island. So I've seen what the traditional physical therapy clinics look like. It's a big reason why I left the clinic and formed my own business. I noticed that there wasn't enough time for me to spend with each patient, and I noticed that some patients just weren't getting better. Physical therapy alone wasn't what they needed. So I became a personal trainer and a nutrition coach to help guide my clients further along their strength and workout needs, plus their nutritional needs. If you've been through physical therapy, but you felt like it wasn't the right fit for you, you already know how to exercise, you just need guidance in the correct ones to do for your pain or weakness, you like to work out on your own, once you know which exercises to do, and you want guidance on how to optimize your nutrition to make the most of your workouts, then I recommend finding out more about how I can help you through my program called the Move Better Method. So you can email me, you can comment below. So the Move Better Method is good for a woman with knee pain. She doesn't quite fit in at physical therapy because it's too easy or there's not enough guidance. She doesn't want to sign up with a personal trainer because she likes to exercise on her own. And she wants guidance on how to maximize her nutrition for optimal results. So if that sounds like you, reach out to me and let's see if the Move Better Method is right for you. Okay, that's everything for now. I'll talk to you guys later.